Today, we will be talking about hemodynamics. Hemodynamics is the study of how blood moves through the cardiovascular system, and understanding it is important because it helps us explain things like blood pressure, tissue perfusion, and things like shock and hypertension. So what is hemodynamics? It is the study of blood flow through the circulatory system. It focuses on how the heart pumps blood and how the blood flows through the vessels. It also focuses on how pressure and resistance affect that flow. The main goal of hemodynamics is to ensure oxygen and nutrients are delivered to tissues and waste products are removed. The key components of hemodynamics are blood pressure, which is the force blood exerts against the vessel walls, blood flow, which is how much blood moves through the vessels over time, cardiac output, which is the amount of blood the heart pumps per minute, heart rate, which is the number of heartbeats per minute, stroke volume, which is the amount of blood pumped with each beat, systemic vascular resistance, which is the resistance blood faces in the vessels, preload, which is how much the ventricles are filled before contraction, and afterload, which is the resistance the heart must overcome to eject blood. Let's break these down, starting with cardiac output, which is the amount of blood the heart pumps in 1 minute. It is calculated by multiplying the heart rate and the stroke volume. If the heart beats faster or pumps more blood with each beat, cardiac output increases. If either decrease, cardiac output falls, which can lead to poor perfusion. This matters because it determines how well oxygen and nutrients are being delivered to the tissues, and helps us understand conditions like shock, heart failure, and sepsis. Like I said before, cardiac output is made by heart rate and stroke volume. And remember, stroke volume is preload plus afterload plus contractility. Now, let's move on to blood pressure, which is the force of blood pushing against the walls of the arteries. This depends on the cardiac output and the SVR, or systemic vascular resistance. The systolic pressure represents the pressure during the heart's contraction, while on the other hand, the diastolic pressure represents the pressure when the heart is relaxed. Having adequate blood pressure is necessary to be able to push blood throughout the body to the organs. Good blood pressure helps ensure adequate organ perfusion and oxygen delivery to the brain and heart. Think of cardiac output as the pump and SVR, or systemic vascular resistance, as the pipes. A person's blood pressure depends on how hard the pump works and how tight the pipes are. Next, we will move into SVR, or systemic vascular resistance. This is the amount of resistance the heart has to overcome to push blood through the whole systemic circulation. It is mainly affected by the vessel diameter. When blood vessels constrict, the resistance increases and blood pressure rises. The same happens with the opposite. When the vessels dilate, the resistance is decreased and blood pressure drops. This is the main way the body uses to regulate circulation. The sympathetic nervous system and hormones like epinephrine and norepinephrine can control SVR. The blood's viscosity can also affect SVR, with thicker blood increasing the resistance and thinner blood decreasing it. With high systemic vascular resistance, the heart works harder, but the stroke volume is lower. Some examples of this are hypovolemic and cardiogenic shock and hypertension. On the other hand, with low systemic vascular resistance, the blood pressure drops despite normal or high cardiac output. Some examples of this are septic and neurogenic shock and anaphylaxis. Next, we will move into blood volume, which refers to the total amount of blood in the circulatory system. This is important because it directly affects preload, cardiac output, stroke volume, and blood pressure. Low or high blood volume can change how good the heart can pump and how well the organs are perfused. This relates to hemodynamics because higher blood volume raises preload, stroke volume, and cardiac output, which raises the blood pressure. On the other hand, decreased blood volume lowers the preload, stroke volume, and cardiac output, which drops blood pressure. Some examples of causes of high blood volume are heart failure, renal failure, and excessive IV fluids. Some examples of causes of low blood volume are excessive bleeding, dehydration, burns, excessive diuresis, and third spacing. A good thing to remember is blood volume sets the preload, which in turn affects the cardiac output. Next, we will talk about perfusion, which is the delivery of oxygenated blood to tissues and organs. Good hemodynamics results in good perfusion. Poor hemodynamics can lead to hypoxia, organ dysfunction, and shock. Perfusion refers to the flow of blood through capillaries of tissues or organs, delivering oxygen and nutrients and removing waste products. Adequate perfusion is essential for normal organ function. Poor perfusion or hypoperfusion can occur in things like shock, heart failure, or severe hydration. This is why things like IV fluids, blood transfusions, and medications are used in hopes of improving perfusion. Some signs of poor perfusion can be cold, pale skin and poor peripheral pulses, with signs of good perfusion being the opposite. Now, why do hemodynamics matter? Hemodynamics help providers recognize and treat conditions such as shock, heart failure, sepsis, and hypertension. By monitoring heart rate and blood pressure, we can assess perfusion and how well the cardiovascular system is functioning. Because hemodynamics directly control tissue perfusion, with inadequate hemodynamics leading to hypoperfusion, which in turn directly affects vital organ functions. In short, good hemodynamics equal good perfusion, which equals organ survival. Hemodynamics also help predict patient outcomes and guide clinical decision-making, helping providers decide if any interventions need to be made, and monitoring the effects and responses to those treatments. The biggest reason hemodynamics matter is because life depends on continuous, adequate blood flow, and when hemodynamics fail, perfusion fails, and organs fail soon after. Now we will talk about the link between hemodynamics and homeostasis. They are tightly linked. Hemodynamics is one of the main mechanisms the body uses to maintain internal balance. Homeostasis requires a constant supply of oxygen and nutrients, which hemodynamics is directly responsible for. Stable blood pressure is also essential for homeostasis, which hemodynamics is responsible for regulating and attempting to keep the blood pressure within a normal range. Hemodynamics also influence renal blood flow, which allows the kidneys to regulate the sodium and water balance and acid-base status, which are crucial in homeostasis and supporting fluid and electrolyte balance. Hemodynamics also respond to stress and injury. During exercise, hemorrhage, or infection, heart rate increases, vascular resistance changes, and blood is shunted to vital organs. These hemodynamic responses maintain internal stability despite external stress. Lastly, when hemodynamics fail, homeostasis fails. For example, in shock, inadequate circulation disrupts oxygen delivery and metabolism, leading to decompensation. Another example is heart failure, where impaired cardiac output leads to fluid overload and organ dysfunction. These examples show that homeostasis depends on effective hemodynamics. If blood flow is not properly regulated, the body cannot maintain its internal environment. To summarize everything, hemodynamics is the study of blood flow and the forces that affect it. Cardiac output, blood pressure, systemic vascular resistance, and blood volume all work together to maintain perfusion. Changes in any of these components can significantly affect the others, altering how effectively the heart pumps and how well organs and tissues receive the oxygen and nutrients needed to function properly. A good understanding of the basics of hemodynamics is essential for patient assessment and clinical decision-making. Also, hemodynamics is closely tied to homeostasis, the body's ability to maintain a stable internal environment, especially when the body is challenged by external stressors and factors, is due to the fact that hemostatic mechanisms adjust heart rate, vessel tone, and fluid balance to preserve blood pressure and perfusion. By understanding how hemodynamics supports homeostasis, healthcare providers can better anticipate the patient's needs, interpret vital signs accurately, and implement effective interventions to restore balance and promote optimal organ function and perfusion. I hope this video helped everyone get a better understanding of hemodynamics and what they do and consist of, along with how hemodynamics and homeostasis are related, and the effects that hemodynamics have on homeostasis. Although it is only the basics of hemodynamics, I feel that it is clear how important its role is in maintaining homeostasis. Thank you all so much for watching. I hope that this was helpful.